I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at a question of the week, and that question is, how often do I have to dilate after vaginoplasty? So let's review the basics in 3 simple points. Point number 1, gender-affirming vaginoplasty is the surgery that creates a female-appearing vagina and vulva in a person who was assigned male at birth. There are a variety of techniques, but in most surgeries, the penis is inverted to create a vaginal canal. The scrotum is used to create the vulva, and the glans penis forms a functioning clitoris. Point number 2, to keep the vaginal canal open and to maintain the depth of the vagina, a woman must dilate using vaginal dilators. Now, the woman starts to dilate the Neovagina about 5 to 6 days after the surgery. She is given her own set of vaginal dilators after her surgery, and she is instructed on how to dilate the Neovagina using a lubricant gel. Now, by the way, I'm using the gender she on this, but there are people who identify male who have vaginoplasty also, just to be complete. Now, here is an example of a set of vaginal dilators at the left. So the small one is the purple one, and it goes up to the large one that's orange. The dilator is inserted gently by the woman. It's not forced. And over time, she gradually works up to the largest, or maybe the next to the largest size. Dots on the sides of the dilator will help the woman gauge the depth of the vagina. Point number 3, the surgeon gives a patient a guide as to how often she must dilate. The technique for how to dilate and the dilation schedule will vary from surgeon to surgeon. Most women will be instructed to dilate 3 to 4 times a day at first, at least for the first month. But then over time, the frequency drops to twice a day, then once a day, and even down to once a week or once a month at about a year after the surgery. But every surgeon is different on their recommendations, so be certain that you know what your surgeon says. So what happens if you do not dilate? Well, the neovagina can actually close, and this is just heartbreaking. It can happen fast, and it may necessitate another surgery if it does close. If you are having difficulty with dilation, contact your surgical team. Do not stop dilating. If necessary, a woman might drop down to a smaller dilator for a time or two, but definitely don't stop. In summary, dilation is necessary to maintain the vaginal canal after vaginoplasty surgery. Your surgeon will provide dilators and will show you how to use them. Follow the instructions of your surgeon and contact your surgical team if you have questions or if you run into problems. Do not stop dilating. The neovagina may actually close. I hope this information has been helpful for you today. If you do have a question yourself and you'd like to have it answered as a question of the week, please submit it in the comment section below. Thank you for watching, and I'll see you in the next video.